Do you want to learn a 4-part formula to be able to sell the treatments easier? Hi, I'm Dr. Germán Gómez and I'm in Valencia, Spain. Today we will talk about the 4Ps method to sell your treatments, and you will learn a simple method to follow and how to adapt it to a dental situation. The 4Ps, 4 steps, all 4 steps start with a P. Okay? The first step is a promise. Okay? We have to promise something. So, what can we promise? Well, we have to set a frame at the beginning of the conversation, okay, so that the patient knows what's going to be at the end. Okay, it's a short one-liner that we can put. It sets the tone for the conversation. Okay, it sets the expectation. Now, an example. Today we're going to work together on your smile design and you will love it. So, what have we done here? We have started the sales process with the patient on a smile design. We have also told him that it will be good for him. So a positive attitude towards this smile design has been created. And we choose always the word together. Okay, so it is something that we do together with the patient. So the patient is involved in the decision making and so on. So it's all together a very positive sentence that sets the tone and sets the expectation of the conversation. The expectation is that he will love it. Then, after the promise, we have to picture. Okay. In order to sell, people have to have a picture in mind of how everything will turn out. Okay, a BMW sales rep will put a picture in your mind about you driving that BMW in a nice valley. You see the mountains, you feel the resistance of the wind, you see the landscape, and you feel this car moving fast. Okay, that's a picture that you have in your mind about you owning already that car. This is a sales trick. Okay, so if you put a picture in the mind of the patient about him already having made that treatment, and that's a positive picture, he will be more likely to buy your treatment. Okay, so you made a picture. Tell the patient a story related to him. Okay, so I don't know if the patient is a businessman or businesswoman. You will look so great and so confident when you smile when you are closing a big deal or something like that. Okay, so there you take the profession of the patient and something he will do in that profession that is positive and tied it to your treatment, okay, or to the outcome of your treatment. You sell then smiling as a confidence builder and so on. Okay, so you build up the confidence of the patient in his profession, and this will be a good outcome at the end. So you picture the patient already pictures himself in that situation. Go after the emotional side of the treatment with that. Put a picture in their mind. We buy based on emotions and then we justify with logic. Let me say it a little bit different. Most of the people buy based on emotions. Not all of them, but most. Okay? Some are pure logic. Okay? But a lot of people who think they are pure logic are not pure logic. Okay. So most of the people buy based on emotions. It feels good, it feels right, I buy it. But then they feel like a little bit uncomfortable with that decision. So they need to justify this decision of buying this that feels good with logical things like features, benefits, and so on. Okay? But first, it has to feel right. And for that, we put a picture in the mind of the patient, him already having undergone the treatment and being very confident or chewing well. You put a picture in the mind of a patient that has a denture that moves a lot, okay? And you want to put some implants to fix that denture, okay? Then what you will tell the patient is, imagine what you will eat as soon as you go out of here, and we have fixed your denture with implants so they don't move. Okay, what will you eat? What is the first thing that you're going to eat? Then the patient already starts to think about that, already owning these implants that fix his denture. Okay, that's another example of this picturing. Okay, next. After picture, so you promise, you set a frame. So we are going to do this today together, okay? And it will be so great. Then second, we put a picture in the mind of the patient. Third, we need to prove to the patient that we are the right choice to do exactly that. Okay, so show, don't tell. You show them whatever cases, okay, before and after cases that you have made in your clinic. Okay? So the patient sees, oh, this looks pretty much like I do now, and that's the before picture. Let me see how it looks after. Wow, that's a big difference. Yeah, and it's not only that, patient testimonials. Show him some patient testimonials. Yeah, Bill said this and that, or Joe said this and that, or Jane couldn't believe how beautiful she was looking. Okay, something like that. You can go to your website, you can go to Google Business and see what the testimonials that are there. So real testimonials to show to the patient. Okay, on the computer, in your clinic, on the when the patient is seated in the chair. You can show him videos or pictures of the procedure itself, so the patient doesn't only hear about the procedure but also sees it. So you show everything, the steps if you want, but much better the before and afters. Steps are usually, I would show, if I would show steps, I would show the provisionals, for example, okay, and then the final outcome, okay, the final treatment. Then this is what you can show. I never show to my patients bloody things, open jaws, drilled teeth. You know, I never show that to them. I show them the before of the patients, maybe the provisional, and then the after. Okay. And you tell stories of the patients behind the pictures. So this is Jane. She came with notice please that she has this and this and this and these things in her mouth that she doesn't like. She didn't like that, and she was going to marry, blah 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 blah. You tell a whole story. Okay, people buy stories, and it looks also much more real that you did it because you know exactly the patient, okay? So tell the stories of the patients, why they came to you, what were their pain points. Maybe the patient who sits down there recognizes these pain points, okay? And then what you did for them, how you did it, and then what was the outcome, and how excited they were that they did the treatment. And after this, you go and pitch. Okay, you go and pitch. That makes sense after the 3 Ps. If you pitch immediately, it doesn't make any sense. You cannot sell anything. Pitch means you make a call to action to the patient. Okay, so let's move forward. Let's do this now. Okay, let's a call to action, a close, if you want to say it. One smooth close here could be, but you will get in another lecture, 10 different closes. So this is what we're going to do next. And then just plan as if the patient had accepted to make the treatment with you. You just go ahead and you do it like he already had said yes. It's an assumption close. Okay, it's called the assumption close. And this is how simple you can close. I hope this video was helpful for you. Thank you very much for your attention. Please subscribe to this channel, click on the bell, turn on notifications, like this video, share this video, and comment below. Bye.